everybody, in this video you will learn how to help yourself while suffering an acute respiratory infection. The following procedure will not cure the disease, but can bring you relief by reducing fatigue or shortness of breath. Some of the symptoms of an acute respiratory infection can be relieved by actively exercising and modifying your breathing. The symptoms are mainly blockages of the ribs and spine and changes in the tension of inspiratory and expiratory muscles. Changes to the musculoskeletal system reduce the efficiency of the breathing cycle and worsen shortness of breath. In addition, you may have a non-productive cough, which we will talk about in the second part of this video. If any of the exercises cause pain to you or are too exhausting for you, do not hesitate to skip them. Unless told otherwise, try to breathe through your nose at all times. But of course, if this is not possible, breathe through your mouth. Anytime you feel tired, you can take a break and rest. To rest, you can choose any posture you feel comfortable in, such as this one. Sit on a chair, lean on the backrest, rest your feet on the floor, hip width apart, your arms out, palms forward, breathe calmly and relax. Alternately, to relax, you can turn your chair around and rest your elbows on the backrest. Rest your forehead on the elbows and breathe calmly and relax. Now sit on the front part of the chair and rest your feet on the floor, hip width apart. Correct the position of your pelvis. Try not to sit with your lumbar spine flexed, but try to sit on the top of your sitting bones. Ensure that your rib cage is directly above your pelvis. Rest your palms on your thighs. Imagine your collarbone spreading to the sides and try to press the lower corners of your shoulder blades gently into the back part of your rib cage. Imagine a string leading from the top of your head up to the ceiling, which elongates your spine. Your head should be right above your thorax, not pulled forward. Now turn your attention to your breathing. Make it smooth, long and relaxed, and try to release any tension of your face muscles, eyes, mouth and cheeks. These exercises may help you. Raise your arm to shoulder height, bend your elbows upwards and spread the fingers out. Push your elbows to the sides. As you inhale, raise your arm, and as you exhale, lower them. Breathe slowly and smoothly. Repeat as many times as you feel comfortable, from 3 to 10. Now relax your arm along your body. Elongate your spine, raise your right arm up, turn the thumb and inner part of your arm back. Stretch upwards and to the left over the center of your body. Inhale and exhale slowly and smoothly. Put your arm back and repeat with the left arm. According to your current ability, repeat 3 to 10 times. Now interlace your fingers and put your hands on the back part of your head. Elongate your spine and at the same time press your chin very gently into the neck. Be careful not to introduce tension by raising your shoulders. Inhale and exhale slowly and smoothly. With next inhalation, spread your elbows out and imagine your chest slightly coming up. While exhaling, roll your spine, bring your elbows in and look at your abdomen. Inhale, come up, and as you exhale, roll down. Repeat it a few times, as long as you feel okay with it. Now rest your hands on your thighs and make soft circles with your head to one side and then to the other side. Then try to make circles with the center of rotation in the middle of your chest. Let your shoulders help with the movement. Inhale and exhale slowly and smoothly as you do so. Now change the direction of rotation. Next, lower the center of rotation to the level of solar plexus. Rotate your chest gently to one side and the other side. Now extend your arm backwards. As you are sitting in the front part of the chair, you should have some space behind you, and rest your fingertips on the chair. As you inhale, push your fingertips gently into the chair, lift your chest up and slightly extend your elbows. Then exhale, round your upper back and look at your belly. As you inhale, come up again. Exhale, roll back down. As before, choose the number of repetitions which suits you the best. Sit even more forward on the chair. Interlock your fingers like this, but behind you, and extend your arms. hold the position, inhale and exhale slowly and smoothly as you do so. Relax every part of your body that doesn't have to work. After about 5 inhales, move your hands to the side of your body and turn your head to the right. Repeatedly, lower and raise your chin up and down, up and down. Move slowly and pay attention to how you are stretching the muscles of the left side of your neck. Then, go back to the starting position. You can choose any number of repetitions you like. And now, move your hands and face to the other side. Repeatedly, lower and raise your chin up and down, and come back. Again, you may feel tension on the right side of your neck, and you can find a position where you feel the tension is most intense, then hold it and breathe. After you return to the starting position, try to sit straight and elongate your spine. Raise your arms and turn your chest slowly to the right. With every inhalation, try to elongate your spine a bit more. On an exhalation, lower your left hand to the right knee and your right hand to the back of the chair. Now as you inhale, try to elongate even more and gently look to the right. Breathe calmly and smoothly, mainly into the abdomen and your lower ribs. Now come back, raise your arms again and slowly turn to the other side. Place your right hand on your left knee and your left hand on the chair. As you inhale, elongate your spine. As you exhale, look gently to the left. Try not to raise your right shoulder, but leave it down and back. And then slowly come back. For the last sitting exercise, move your feet out a bit. Interlace your fingers once again behind your back and extend your arms. Inhale. As you exhale, slowly bend forward as far as you can. Inhale, come up, and as you exhale, pull your hands up to the ceiling. And then come back again. Choose the number of repetitions which suits you the best. Now it's time to rest. To relax, you can choose one of the sitting positions mentioned at the beginning of the video or lay down as follows. Prepare a support. You can use a blanket, roll it up and tie it to make a stable and solid bolster. Prepare a blanket under your forehead, put your toes together, knees a bit apart, sit on your heels and rest your body and head on the support. Open your palms, spread your fingers out and rest your forearms on the mat. Breathe smoothly and calmly. Release any tension you are aware of. Focus on these parts of your back and try to breathe there as if you wanted to expand sideways. You are using your diaphragm. You can imagine there is a flower in this area where your diaphragm is. Imagine it opening as you inhale and closing as you exhale. Stay in this position until you feel refreshed enough to continue with exercises. Now go on all fours. Rest your knees right under your hips and press the tops of your feet into the mat. Put your hands under your shoulders and spread your fingers out. As you inhale, bend your spine inwards, especially the thoracic spine, but do not bring your head back too much. As you exhale, look at your belly, but try not to raise your shoulders towards your ears. Inhale, come up, exhale, go down, continue in the rhythm of your breathing. According to your current ability, repeat 3 to 10 times. Now lengthen your spine and as you exhale, raise your arm to the side and watch your hand all the way up. Exhale, come down and go to the other side. As you inhale, come up. As you exhale, go down. Now put your shins close together. Raise your feet a few centimeters above the mat. Inhale and as you exhale, bend your spine sideways as if you would like to look at your heels with your ear. Do not push too much, do it gently. As you inhale, come back and slowly go to the other side. Try not to bend your neck to look at your heels, but bend sideways. Make a smooth curve with the full length of your spine from head to pelvis. And again, choose the number of repetitions which suits you the best. Now perform the same sequence resting on your elbows. Put your forearms down, put your elbows under your shoulders, turn your palms down and spread your fingers out. Turn your attention to your breathing. Make it smooth, long and relaxed and try to release any tension of your face muscles, eyes, mouth and cheeks. As you inhale, gently bend your spine inwards. As you exhale, round your back and look at your belly. Inhale, come up, and exhale, go down. Ensure that you mostly bend the thoracic spine and not just bending your neck. And while bending, try to make the curve of your spine even. Now as you inhale, raise your arm to the side and watch your hand all the way up. Exhale, go down, and inhale, go to the other side. Now put your shins together, raise your feet, inhale, and as you exhale, bend your spine sideways as if to look at your heels with your ear. Inhale, come back, and exhale, go to the other side. And return to the starting position. Now lay down on the mat, spread your arms to the sides, or you can bend your elbows, open your palms, and spread your fingers out. Rest your feet on the mat, hip width apart. Lift your pelvis up and shift it to the right side. Release your pelvis down and also move your legs to the right. Now cross your right leg over the left one, bring your legs closer to your belly, and as you exhale, slowly bring your legs to the left. Keep your right shoulder blade in contact with the mat, and you can gently turn your head to the right. Try to elongate your spine and breathe calmly, smoothly and softly. You can put your hand on your side to feel your breathing better. Then slowly return to the center. Shift your pelvis and legs to the left side. Cross your left leg over the right one, bring your legs closer to your belly, and as you exhale, slowly bring your legs to the right. Try to keep your left shoulder blade in contact with the mat, and you can gently turn your head to the left. Breathe calmly and smoothly. Keep the position for a few breaths, and then come back to starting position, uncross your leg, and turn to lay on the right side. Your musculoskeletal system is now better prepared for the breathing exercises. Before we continue with the breathing exercises, I would like to tell you more about the non-productive cough. A non-productive cough, also known as a dry cough, is defined by the inability to cough up mucus. It is often very exhausting and deepens unfavorable changes to the musculoskeletal system. Why does the non-productive cough occur? If there is inflammation and mucus in the lower respiratory tract and alveoli, the inflammation irritates the respiratory tract. The irritation of respiratory tract now provokes coughing reflex, but as long as the mucus is down there, the expectoration cannot occur. Our aim is to keep breathing calm and steady for as long as possible, so the mucus can come up higher in the respiratory tract and can be coughed up. It can be beneficial for you to find a way to suppress this reflex. Recommended ways include very slow breathing, swallowing, quick blinking, but you can find your own way which fits you the best and helps you eliminating your cough. It can be beneficial for you to find a way to suppress this reflex. Recommended ways include very slow breathing, swallowing, quick blinking, but you can find your own way which fits you the best and helps you eliminating your cough. Regular use of an inhaler can help as well. Inhale and exhale slowly, softly and smoothly. As you inhale, try to feel the spreading of your sides, and as you exhale, feel the gentle release but no squeezing. The same action should be felt in your pelvic floor. But if you are not used to that, most likely you might not feel very much. Try at least 10 breathing cycles. Then put your hands on the side ribs, your side lower ribs. And as you inhale, widen them, and on exhale, release them back. Inhale slowly and smoothly, and exhale slowly and smoothly. You want your eyes and face to be relaxed. Then put your hands to the top of your rib cage and try the same again. Inhale slowly, softly and smoothly. Exhale slowly, softly and smoothly. You can also put your hand under your arm onto your upper side ribs. The other arm should be totally relaxed. And again, slowly, smoothly inhale and exhale. and do the same on the other side. If your hand feels any rustling or crunching, if you feel a turbulent stream of air which goes through the narrowed airways, that is where the mucus obstruction remains. You can go back to that place and put your hand there again. Gently breathe into your hands. Inhale slowly, smoothly and softly, and exhale smoothly, softly and slowly. Try not to hold your breath. If possible, do not elevate your shoulder blades. It can be difficult at the beginning, but try to feel where the mucus is with your hand. When you find a place where the rustling sounds come from, direct your breathing toward your hand. Your hand shouldn't press against your ribcage. Just follow the breathing rhythm and be aware of the sensation coming from it. And now inhale slowly, and at the end of the inhale, hold your breath for about 2, maximum 3 seconds, but not more. Hold it and then slowly inhale. By doing this exercise, we aim to support collateral circulation in the most infected part. You can repeat it up to 5 times in one place. If there is another affected place, you can once more put your hand there, inhale easily and slowly, hold your breath for 2 to 3 seconds, and then slowly, gently exhale. Certain devices can also assist the effective evacuation of mucus from your airways. If you've had problems with your respiratory system for some time, you may own these 2 devices. This is an Acapella and this is a Flutter. I recommend using them only if you know how to use them. They are very effective, but you need to know how to work with them. If you do not have these devices, you can use a glass of water and a straw. Inhale slowly and deeply, and then exhale into the water. Why is this method helpful? It increases external respiration resistance. The bubbling water also creates an oscillation and changes the expiratory pressure in your airways. These 2 parameters make it much easier for the mucus to move up in your airways. If you decide to use this method, it is important to keep your spine straight and your shoulders wide and relaxed during breathing. Be careful not to push your head forward. Do not lift your shoulders and elbows, and do not inhale sharply or too quickly, and do not lift up your ribcage. Pay attention to your shoulders. They need to be relaxed. Your spine straight. Inhale slowly and then slowly, smoothly exhale. After you finish this exercise, you can inhale through your nose and slowly exhale through your mouth. If the mucus has moved up high enough, you can try huffing. Huffing is a replacement for coughing. You can do it at most twice in a row. Inhale slowly and carefully so that you do not pull the mucus back down again. You make a sharp "ha" sound to push the air out forcefully, like this. You can repeat it up to 2 times, and ideally the mucus has come out. After the exercises we did at the beginning that aim to mobilize your ribcage and stretch your muscles, and after breathing exercises, we now continue with relaxation techniques. It is important not to skip them. I'll show you 2 methods. The first one comes from yoga. You put your thumbs into your ears and pluck your ears. This is useful because you'll hear the sounds you are emitting better. Then cover your eyes with your index and middle fingers and place your right finger by your nose and the pinky by your mouth. Fingers by your mouth and nose are not so important for the exercise. The thumbs in your ears are the most important. It is also important that the fingers resting on your face are relaxed. And again, do not pull your shoulder blades towards your ears. They have to stay down. You can do this exercise sitting up or lying down in position I am going to show you. Before I lay down, I'll show you what this exercise looks like. Inhale slowly and deeply into your belly and to your lower ribs. And when you exhale, make a sound that is similar to the sound that a bumblebee makes. It is a fine, slow, smooth humming. Of course, the sound each person makes will be a little different sound. You can choose as many repetitions as you like, ideally at least 3. If you do this exercise relaxed and without any excessive tension, it should bring you relief and refreshment. Now I'll show you how to perform this exercise lying down. Bend your knees, put your soles of your feet together, and if your hips are tight, you can support your thighs from below to make the position relaxing and comfortable. After that, support the area between your lumbar and thoracic spine with the bolster and slowly lay down. It is important to support your head enough so your neck is straight as possible and your chin is not pointing up. Then you can put your arms to the sides. If your shoulders lift up, you can instead bend your elbows and put your arms on your forehead. If you feel that your shoulders are more flexible, you can also put them behind your head on the support. Or in case that you are doing Bhramari, put your thumbs into your ears, 2 fingers on your eyes, and the last 2 fingers by your nose and mouth. Inhale slowly and smoothly and make the sound I have shown before. To close out, it is important to relax. To do this, you can lie in this position, you can lie on your back with your knees bent and feet resting on the mat, or you can sit down and put your hands on the back of the chair. Now close your eyes and relax. Draw your attention to your toes and relax them. Focus on the tops of your feet, your soles, your ankles, your shins, your calves, your knees, thighs, your groins and your hip joints. Focus on your pelvis and imagine your pelvic floor. Feel how the tension in your pelvic floor changes as you inhale and as you exhale. Then focus on your belly. First, relax the lower part of your belly, from your belly button down to your pelvis. Relax the right side of your lower belly and then the left side. Then relax the area above your belly button, from your belly button towards your lower ribs, on the left and on the right side. Now try to relax the belly not only on the surface, but also inside. You want to notice any tension in your belly and keep relaxing any of these tight spots as you exhale. Release any tension in your lower back directly above your sacrum, on the right side of your spine and on the left. Relax the lower ribs area. Breathe smoothly the whole time. Do not force your breath anywhere. Let your breath flow and follow it. Relax the right side of your rib cage and the left side. First the lower part above the belly, then take your awareness up to your armpits. Relax the back side of your rib cage, around your spine and your shoulder blades. Then relax the front side. Relax your fingers, your palms of your hands, the back of your hands, your wrists, your forearms, your elbows and your upper arms. Relax your shoulders. Release any tension in the back of your neck. Draw your attention to the place where your neck meets your skull and to the muscles directly below your skull at the back of your neck. Imagine that any tension there is releasing each time you exhale. Be careful not to try too hard to relax. It would just create more tension. Relax the sides of your neck, front part of your neck, and the same as in your belly and your chest, relax not only the surface, but release any tension inside. Relax the skin on your head from the back side of your head, the top of your head, and up to your forehead. Relax the area around your ears, your forehead, your eyebrows, your eyes, and your cheeks. Release your jaws. Be aware of any clenching or tightness there and try to release it. Relax your tongue. Just concentrate on your breathing. Follow it as you slowly, softly, smoothly inhale, and then as you slowly, softly, smoothly exhale. Thank you for your attention. I wish you good health. Take care.